Welcome to the Addiction and Co-occurring Disorders Treatment Manual video series. In this video, we're going to be discussing the introduction to co-occurring disorders, what they are and what you need to know. We're going to define addiction and mental health issues, as well as physical health problems, which may be present in early recovery, and explore how these issues interact and why it is vital to treat the person holistically. That means address their behavioral health issues, their addiction issues, as well as any physical health issues they may be experiencing. Addiction, as most of us know, is the continued use of a substance, person, or activity to eliminate or escape from discomfort despite experiencing negative consequences from use. And that is really what defines problematic use or addiction and differentiates it from regular use or sporadic use. Continuing to use despite the fact that it's causing you negative consequences. Some of the symptoms that we look for in addiction include trying unsuccessfully to quit, spending more time or money than intended, obsessing about getting, using, and recovering from the substance or behavior, reduced involvement in important personal activities as a result of using, and experiencing repeated health, mental health, relationship, financial, employment, or legal issues as a result of use. When we talk about addiction, we're not just talking about substances. People can have these symptoms in relation to relationships, gambling, gaming, sex, pornography, food, and more. Any behavior or substance that you use that meets these characteristics may be considered addictive or problematic, and it's going to be important to address that in recovery. Remember that addictions are a creative solution to a problem when all else has failed. Try not to beat yourself up for the past. Right now, you're recognizing that it's a problem and you're taking positive steps to addressing the problem and finding new ways, new solutions to deal with the problems. If you are doing this as part of a treatment program or in group, take some time and apply these characteristics to alcohol use, relationships, gambling, gaming, sex and pornography, and food. Talk about what that might look like when you try unsuccessfully to quit one of those things. What does it look like when you spend more time or money than intended obsessing about getting, using, or recovering from one of these things? What does it look like when you have reduced involvement in important personal activities? What are those things? You know, it may be going to your kid's soccer game. It may be going to the gym. What is it for you? And what does it look like when you experience health, mental health, relationship, financial, employment, or legal issues as the result of use? So start making a list of the different types of negative consequences that may occur when you use. It's important to remember throughout this process that you are a person with an addiction. When you're no longer symptomatic, you are still going to be a person. So what kind of person do you want to be? Take some time. Talk amongst yourselves about what you want your sober self to be like, to look like, to feel like. Now, I said earlier that we were going to talk about co-occurring disorders. Very rarely do people have simply an addiction. A lot of times they have some other stuff that goes along with it. They can be mood disorders or physical disorders. We're going to start out by talking about mood disorders. And what we're really talking about here are depression, bipolar, and anxiety disorders. Mood disorders can cause or worsen mental health issues and trigger addictive behaviors. And addictive behaviors can alter your brain chemicals, which may trigger depression, anxiety, or other behavioral health issues. Mood disorders also alter your brain chemistry, so you may try to self medicate with addictive behaviors. You may feel really bad, so you try anything you can to help yourself feel better. I'll say it again. It is important to treat all of your physical, psychological, and addictive issues at the same time, because a sober person with raging anxiety is going to have a lot of difficulty staying sober. And a person in excruciating pain is going to have difficulty staying happy and sober. It's important that we address the whole person. Take some time and think back over your history. In what ways has depression, guilt, anxiety, anger, or resentment triggered your addiction? Once you've spent some time thinking about that, then think about, in what ways has your addiction caused depression, guilt, anxiety, anger, or resentment? I want you to see that one can cause the other. It's a bi-directional thing. Let's specifically talk about depression right now. Depression is characterized by apathy, having a low mood more days than not, feeling kind of like Eeyore. There is no color. It's all gray. There can be changes in eating or sleeping patterns. Sometimes some people sleep more, some people can't sleep at all. Some people eat more, some people have no appetite, but it's a change for you. You may experience excessive guilt over a lot of things and feel it a lot of the time every day. You may have difficulty concentrating, feel fatigued, or have what we call psychomotor slowing or agitation. There's just no real easy way to say this. Basically, it means everything you do, you feel like you're trudging through mud, or you feel like you're walking into 100-mile-an-hour wind, and it feels a million times harder to do the things. I mean, like physically, your body feels heavier and it feels harder to move. On the other side, the psychomotor agitation is when somebody can't sit still. They're not happy, but they're anxious and they're having difficulty sitting still, and they might need to be moving a lot. And finally, a symptom of depression is thoughts of suicide. And if you're having thoughts of suicide, it is important to right now contact a local behavioral health care provider, contact your local EMS, whatever you need to do to stay safe. Now that you know the symptoms of depression, I want you to think about how each one of these symptoms could trigger addictive behavior. You don't have to meet the full criteria for depression in order to feel depressed. What you want to look at is symptoms. What symptoms might you have that might trigger a relapse? So you can prepare for them, you can plan for them, and you can deal with them. So again, go through each symptom one by one and identify how it could trigger an addiction relapse. And for each way it could trigger a relapse, identify 3 ways of dealing with that symptom. So when you are having apathy and low mood, what are 3 ways of dealing with that symptom? When you're having changes in your eating habits, what are 3 ways you can deal with that symptom? And so on. Keep this in your journal. That way, should you start experiencing one of these symptoms, you have something that you can easily go back to and say, oh yeah, I remember I thought that I could try one of these 3 things if I started having this symptom. The next thing we're going to talk about is mania, or in some cases, hypomania, which is kind of like mania light, if you will. When people are in a manic episode or a hypomanic episode, they tend to have elevated, expansive, or irritable mood. Now, elevated and expansive, they are happy. They are high on life. They are excited. A lot of times you're going to notice that is much different than how they normally are. If they have an irritable mood, that is pretty self-explanatory. When they're revved up, they tend to be irritable, touchier, crankier. a little bit more unpleasant to be around. So mania is not always a happy thing. They may have inflated self-esteem or grandiosity, feeling like you got the world by the tail and you are impervious to everything. They may have a decreased need for sleep, be more talkative than usual, experience racing thoughts. I mean, having a hard time slowing down and focusing on anything. They may be easily distractible. If you think, I believe it was in the movie Up, where the little dog would be talking and all of a sudden he'd be like, squirrel. Well, that easily distractible is common in mania and hypomania. There can also be an increase in goal-directed activity or restlessness, and an increase in impulsive behaviors, especially that lead toward pleasurable outcomes that can include gambling, sex, and other adrenaline-laden activities. Just like we did with depression, I want you to think about each of these symptoms. How could any one of these symptoms trigger an addiction relapse? And what are 3 ways that you could deal with each symptom? Finally, in mood disorders, we're going to talk about anxiety. People who have anxiety experience a feeling of restlessness or being keyed up or on edge all the time. You're high strung, some people may say. You may find that you're easily fatigued. Well, when you're high strung all the time, it gets exhausting. You may find that you have difficulty concentrating or your mind goes blank. You are irritable, you have muscle tension, or again, you have disturbances in your appetite or your sleeping patterns. Just like the other ones, I want you to go through each symptom and identify how each one could trigger a relapse for you, and 3 ways that you could deal with each symptom. The way that the person next to you deals with the symptom, the way that your mother deals with the symptom may not be the same way that you deal with the symptom. What are 3 ways that you could deal with the symptom of restlessness, for example? When you're restless and keyed up, what could you do to help yourself relax or use that energy in a positive, constructive way? One other mental health issue that we're going to talk about is ADHD. There is a high correlation between people with addictions and people with ADHD. And there are a lot of features of ADHD that can contribute to an addiction relapse. One of the symptoms is failing to pay attention or making careless mistakes. Another is not following through, having difficulty organizing and planning, and this may even include relapse prevention planning. Disliking tasks that require sustained mental effort, like reading the big book or doing some of your activities. Being easily distracted, forgetful, being fidgety or having difficulty sitting still, talking excessively, having trouble waiting your turn, or interrupting and intruding in conversations. And this can be especially problematic, for example, in big book studies or 12-step meetings or support group meetings. Just like with all the other issues that we've talked about up until now, I want you to look at each symptom. And even if you don't have ADHD, I think most of us experience pretty much every one of these symptoms sometimes. So I want you to look at each symptom and identify 3 ways of dealing with each symptom. When you notice that you are going through a period, maybe you're overwhelmed, you got a lot of stuff going on, so you're not paying careful attention, you're making careless mistakes. How can you prevent that from causing a relapse? How can you deal with that? For example, removing distractions, writing things down, having somebody double check your work. There are a lot of things you can do, but you can brainstorm ways to deal with those issues. Now let's move on from mental health issues to physical health issues. People who are in pain, people who are sick, people whose bodies are not functioning 100%, that means their bodies may take longer to recover and their brain chemicals may take longer to rebalance. People who have autoimmune disorders often are also in chronic pain. Autoimmune disorders are often associated with systematic inflammation, which is associated with depression. We're not going to go through each symptom of each one of these physical health disorders, but it's important to know if you have an autoimmune disorder, if you have chronic pain for some reason, if you have diabetes or hypertension or a variety of other physical health issues, it's going to be important to talk to your doctor and figure out ways to deal with the unpleasant symptoms of these issues. Figure out ways that you can get stabilized and have be as healthy as possible with these issues, so your brain can rebalance and you can focus on your treatment and having a rich and meaningful life. If you have a physical issue, it's important to identify how that condition could contribute to a relapse. It's important to go in and get a physical to rule out any conditions that you might have that might be causing mental health symptoms that could cause a relapse. For example, low thyroid can cause symptoms of depression, which can cause people to relapse. High thyroid can cause symptoms of anxiety, which can cause people to relapse. There are a lot of very simple tests, blood tests that your doctor can do to make sure that your body system is functioning as optimally as possible for you in order to make sure that your physical health doesn't trigger a relapse. Addictive behaviors are creative solutions to problems, including mental health or physical illnesses. These things, unfortunately, often cause more problems with mental and physical health, relationships, finances, employment, and more. Mental and physical health issues can be caused by or worsened by addictive behaviors. And recovery involves developing an awareness of what triggers your mental or physical health problems or your addiction, knowing addictive behaviors you often use to cope with the stress, and developing alternate skills to help you start dealing with life on life's terms.